Hello everybody, welcome to my YouTube channel NurseEd Simplified. Before you continue, let's first like and subscribe my channel so that you can get more notifications when it leads to difficult topics. Now we are going to talk about congestive heart failure, and this was requested by one of the BSc students to have a better clearer idea about it. So what is a congestive heart failure? So before we go into it, I'll talk to you about the disease, its pathology, how we diagnose it, its management, care plan, and its prevention. Now, how do you define? Congestive heart failure is the inability of the heart to pump sufficient amount of blood to meet the oxygen and the nutrient demands of the heart and the body. So you can see in the picture that the normal in a normal heart, the normal volume of the oxygenated blood, it is pumped into the body via the left ventricle and it's happening smoothly. But when it comes to a heart failure, the volume of oxygenated blood becomes reduced because of the resistant ventricles, whatever be the etiological factors. And so your oxygen rich blood is not going efficiently to the different parts of the body. Next, we come to the conduction of the heart. Before we go into details, let's see the conduction of the heart, how it works. So as you can see, this is your heart which is working. We dissectioned it and we have the upper chambers and the lower chambers. Under the upper chambers and the lower chamber, we have right atrium and the right ventricle. And on the left side, we have the left atrium and the left ventricle respectively. So what do we do? What we do is we have this blood which is not oxygenated going into left ventricles and into the pulmonary circulation. After that, after it enters into pulmonary circulation, it is the oxygenated blood returns back after the gaseous exchange into the left atrium, left ventricle, and then via aorta it goes into the systemic circulation for to all parts of the body. This is about the conduction of the heart. Now we talk about the risky factors or what are the etiology. So when we talk of any cardiac condition, when we talk about risk factors, it also means that they are the etiological factors also. Okay, do not be confused about that. So when we talk about faulty heart valves, either there may be a stenosis of the valves or a regurgitation. In either way, you will have its effect on the congestive heart failure. Arrhythmias, whenever there is an atrial fibrillation or a tachycardia or a tachyarrhythmia, it means your heart is pumping even faster and harder, and thereby your ventricles does not have enough time to relax. So that can lead to a congestive heart failure. Infarction, what happens is whenever you have infarction, there is a reduced blood flow to the heart, and that leads this brings about narrowing of your arteries. Because of the narrowing of your arteries, and because of this reduced blood flow, it means your heart muscle or your ventricles, they are working harder to pump enough blood. Lineage, it is already there in your family history. Uncontrolled hypertension, because of thickening of the walls of the ventricles due to hypertension. Recreational drug use, if you're a drug user or an alcohol abuser, or you have some sort of addiction, in that case also you may have you may have a risk factor for this my sorry for congestive heart failure in that case, because of this. And even if you are you have smoking habits or something like that, then in that case also, because you're depriving your heart of hypoxia, so there is diminished respiratory drive. So opioids, they, what is their work? They diminish your respiratory drive and they cause hypoxia. So this in way leads to congestive heart failure due to some cardiac arrest. Okay, and now if we have some, I call evaders, which means that your viruses or infections that affect your heart muscle specifically, like your rheumatoid or something like that. Now, there are basically four types. We classified into four types, that is systolic and diastolic heart failure, left-sided and right-sided heart failure. You'll be more commonly knowing them, and acute and chronic heart failure, and forward and backward heart failure. Let's go to them in details. So, first type, systolic and diastolic. Systolic means inability of the heart to contract to provide enough blood flow forward. So, where the problem is, it is the pumping problem. Your contraction of the ventricles is not happening properly. That is when you see if a diagnosis is heart failure, systolic left systolic heart failure. Okay, which means the pumping of left ventricle is not being able to pump it properly. What do you mean by diastolic? It is the inability of the left ventricles to relax completely, because unless there is relaxing, you cannot have filling. So that is why it is called the filling problem. Unless it relaxes, you cannot fill it. So if you cannot fill it, it will lead to fluid back into the lungs. That is what happens in the left sided heart failure. That is why we commonly call left sided heart failure as diastolic heart failure. You will see it. Now, again, we come to the difference, the second difference, that is a left side and a right sided. Left sided is inability of the left ventricles to pump enough blood, causing the fluid back into the lungs. So, it will lead to, when you talk about left sided heart failure, remember you are talking about, if you remember the physiology of the conduction of the heart. So after the blood, the deoxygenated blood is supposed to go to the what do you call that, the pulmonic circulation. What if it doesn't go? So your fluid is filled back. It pushes back up to the lungs, and it causes respiratory symptoms. Now, what do you mean by right-sided heart failure? Now, that is inability of the right ventricle to pump efficiently, causing fluid back up to the abdomen, feet, leg. So basically, you will see what changes here. Systemic changes like are related to your abdomen, that is your edema, your feet and leg, that is your ascites. You will see symptoms like that. Why? Because on the right side, remember, you have the liver. So we have the portal, we have the hepatic system also there. So your hepatic vein is there. So you're basically, when there's a right-sided heart failure, remember, right side of the vein is your liver. So you will have liver related, like you may have ascites, or you may have symptoms like peripheral edema. Okay. Next, we come to acute and chronic. As the name suggests, acute means it has been immediate and it's emergent. So which needs immediate attention. And chronic means it because of your cardiac issues or because of these cardiac inabilities, maybe stenosis or regurgitation. There are long-term conditions where the patients will keep showing this chronic symptoms of heart failure. Forward heart failure. What do you mean by forward heart failure? Means there is decreased cardiac output resulting in inadequate perfusion. Backward means blood remains in the ventricles after systole also, and that increases your AV pressure, atrioventricular pressure, and there is rise in the venous fluid out of the capillary membrane into where the extracellular space. Now we come to pathophysiology. When we talk about pathophysiology of congestive heart failure itself, we divide it into right-sided and left-sided. That's when you can identify where your heart respiratory symptoms come and where your other symptoms come. So when you have a left-sided heart failure, due to many reasons, as we told already, the risk factors that we already spoke about. So when there is a left-sided heart failure, for whatever causes it may be, it can be varied, depends upon the condition. For example, if the patient is having coronary artery disease or a high blood pressure or a heart attack, so in those cases, or cardiomyopathy or some sort of valvular heart diseases, in that case, the patient will have a will go into left-sided heart failure. And when you have a left-sided heart failure, that is inability of the ventricles to pump enough blood, that leads to decreased cardiac output and pulmonary congestion. Because remember, left side of your heart, you have the heart trying to reach it to the pulmonary circulation. Remember we said that? Okay. And if there is decreased cardiac output, patient will come to you with activity intolerance and signs of decreased tissue perfusion. If we comes to pulmonary symptoms like impaired gas exchange, cyanosis, hypoxia, or symptoms of pulmonary edema, what we learned, like pink coffee, frothy sputum, or with paroxysmal nocturnal dyspnea. You have to identify it that the patient is in left-sided heart failure. Now, what if the patient comes to you with symptoms like your liver congestion or your dependent edema or anorexia, weight loss? You must understand that there has been some congestion of the peripheral tissues relating to your right side of your heart. So there is issue with the right ventricles trying to do its work properly. Maybe the inferior, what happens when your right ventricles are not working properly? So it will push back blood into the inferior and superior vena cava, which is indeed helping the hepatic vein for its portal circulation. Am I correct? So the portal circulation is impaired, and that leads to these liver congestion sign and symptoms. Now we come to them in detail. Cardiovascular, what are they? You will see patients with tachycardia because the heart is trying to compensate for the pumping inability, irregular heart rate, palpitations, S3 gallop. This is very, very important because this is an extra heart sound which you will hear when you have a patient specifically with a congestive heart failure. So what does it do? It means this sort of heart sound, it is very important to identify to be able to know that this particular patient is in congestive heart failure. Why? Because this sound typically occurs between the two lub and dub sound, that is between S1 and S2. So you will hear this sound, basically maybe it is at the beginning of the middle third of the diastole, and to be more specific, the causes are, as we told you, it can be due to this reason. So how do you understand that it can be because of the mitral valve stenosis or due to a mitral regurgitation or whatever, or due to a VSD or a ventricular septal defect. You can hear these cardiac conditions, specific if you get a patient with these cardiac conditions, like as I told you, mitral MR and VSD, you will see that this patient will have an S3 gallop or this S3 extra sound. Okay, next we come to respiratory symptoms. We will have patients with a right-sided heart failure coming to you with dyspnea, especially when he's lying or when he's exerting some sort of activity. Even at rest, some people will come to you with coughing, like a pink frothy sputum, as in pulmonary edema or wheezing. Mostly you will see the patient coming to you with the crackles. At the end, you will see it going towards wheezing. Okay, pulmonary edema, fluid buildup in the lungs causing shortness of breath. Gastrointestinal, you will see loss of appetite and decreased appetite because your heart is trying to having low cardiac output. So it's trying to do its multiple work. So you will have this fluid buildup in the abdomen, the decreased blood flow to the digestive system to be able to help you in metabolism and digestion. Next, we come to abdominal swelling, bloating. Patient will always tell you, I'm having like this bloating feeling. You might even notice ascites, as I told you, if it is a right-sided heart failure. Okay. Renal. What happens is when fluid shifts during the night, it can lead to increased urinary tendency, nocturia of the patient. Now we have musculoskeletal. We have something called peripheral edema with patients with swelling in the legs, ankle, feet due to fluid retention, fluid overload. So a patient with a right-sided heart failure is called a complete heart failure, congestive heart failure. So we will see this typical symptom along with fatigue and weakness. And neurological symptoms are your confusion, impaired thinking because of reduced blood flow to the brain can lead to confusion, memory problems, and even due to hypoxia. Okay, because the oxygenated blood is not being going through your brain properly. A patient might complain of dizziness and lightheadedness due to a decreased cardiac output. Gastrointestinal because of loss of appetite and nausea due to the fluid buildup there into your stomach. And associated symptoms are your weight gain. That is a key indicator. You see that the weight has been different. Exercise intolerance, skin changes like poor circulation, pale, cool. Now, when you talk about right-sided and left-sided heart failure, what are the specific symptoms for right-sided heart failure and what are the specific symptoms for left-sided heart failure? We see swelling in the legs or the ankles. That is, we call pitting edema or we call dependent edema. And jugular vein distension, that is swelling of your neck veins. fatigue, loss of appetite, confusion, rapid weight gain. So these signs, they repeatedly suggest you of right-sided heart failure. When we talk about left-sided heart failure, we have SOB, pulmonary edema, more respiratory symptoms. You will see coughing and fatigue, weight gain, or irregular rapid heartbeat, or pulmonary crackles or rates. Now, this is another classification of the staging of heart failure. If they say a class, what do they call a class 1 heart failure? Which means there are no heart failure symptoms. Class 2 heart failure is everyday activities can be done without much difficulty, but exertion, if they're supposed to do, it will cause them shortness of breath. Class 3 heart failure, it is very difficult to complete everyday activities. Class 4 is SOB occurs even if they are at rest. So this category is the most severe or complete heart failure, what we call. How do you diagnose a heart failure? Number one is by the medical history and physical examination. Like if you have if you see an enlarged heart or abnormal heart sounds like a third heart sound, S3, or a fluid retention, whatever sign and symptoms you see. ECG can tell you if there is any arrhythmia that is the reason for this congestive heart failure. X-ray will show you enlarged heart, cardiomegaly, and fluid in your lungs. That is some sort of pulmonary congestion. Blood tests are the most common elevated BNP, which means brain natriuretic peptide. It is a strong indicator of heart failure. The more the proBNP, the more your heart is at risk. Cardiac troponins will see if there is due to an infarction. Complete blood count to see if it is for anemia. Your electrolytes and your bun creatinine to see if there's any kidney function affected, or is that the reason for the heart failure, and your liver function test to see how much your liver is affected because of this circulation impairment. Now, echocardiogram. The ultrasound of the heart basically tells you what we are trying to see, the ejection fraction, which I will discuss later. It is how much your blood is being pumped with each beat. Now, exercise stress test, that is a widely accepted way to see during physical activity, is your heart able to tolerate it. So, it will evaluate the severity of the heart failure. Now, as I told you, what is an ejection fraction? It is how well your heart is pumping your blood. So, it is the amount of blood pumped out of your ventricles each time it contracts. Generally, how do you attain this ejection fraction? That is what is the formula. How you attain the formula for ejection fraction, that is another very important part, because sometimes, most of the time, it is always there, but what if it is not? So SV into EDV, stroke volume. SV is stroke volume, and EDV is end diastolic volume. So ejection fraction will be stroke volume into end diastolic volume. Uh, Sorry, SV, stroke volume, divided by your end diastolic volume, whatever amount you will get, into 100. That is your percentage. Okay. So as you can see, the reference range I have shown you. In the male, expected is 50 to 70, female, and we call it mildly abnormal if it is less than 52, and severely abnormal if it is below 30 in both the cases. Now we come to treatment. As you know, in all my presentations and my teaching, I always divide my treatment for any disease into three: pharmacological, non-pharmacological, and nursing. So under pharmacological, you will see a patient coming with this congestive heart failure. He will be started with so many medications. Number one, starting with ACEI. What do you mean by ACEI? That is angiotensin converting enzyme inhibitor. So what does it do? It blocks the conversion of your what does it do? It basically blocks the conversion of angiotensin 1 into angiotensin 2. So your reduces your vasoconstriction and your blood pressure. That is what they do in the case of like medicines like captopril is given to you. Okay. Now, what are ARBs? ARBs are angiotensin receptor blockers. What are they? They are a class of medication which blocks the angiotensin 2 to it blocks it at the receptors. So it is also the same work. It reduces vasoconstriction and your blood pressure, like your losartan. Beta blockers, they reduce your heart rate and your blood pressure. So basically, it reduces your heart's workload, like your metoprolol. Diuretics, they decrease the fluid retention or your overload, or you give furosemide. And pharmacological, we have two main drugs that we give also along with the other drugs, that is a digitalis. Why? Because we want to increase the heart contractility. We give digoxin. Calcium channel blockers are your amlodipine, nifedipine. What we do is they reduce the systemic vascular resistance, that is your vasoconstriction, and thereby through vasodilatation. What is a non-pharmacological management? That is your dietary adjustment, sodium restriction, fluid restriction, nutritional support, obesity and weight management, physical activity exercises. Now, under exercises, they tell you to do regular physical activity, exercise training, which can improve your capacity, quality of life. Now, cardiac rehabilitation and substance use cessation. If you're using any substance like alcohol or whatever, they will help you to do that. And smoking cessation, alcohol abstinence, and how you your circadian breathing or your sleep disordered breathing, mood disorders, weight monitoring, stress management. These are non-pharmacological management. Nursing management mainly involves around these 7 elements. Number one is assessment, give oxygen, give the medications required to relieve the symptoms, education, do not give fluid unless indicated, education and support. Now we come to the most important part, that is your NANDA nursing diagnosis. So under NANDA nursing diagnosis, we have decreased cardiac output related to altered cardiac ability, altered heart rate or structural abnormalities like an MR or a VSD or whatever, as evidenced by fatigue, dyspnea, decreased peripheral pulses, hypotension, and excess fluid volume related to compromised regulatory mechanisms, that is your heart failure, and as evidenced by edema, weight gain, dyspnea, pulmonary congestion, jugular vein distension. We have impaired gas exchange related to alveolar capillary membrane changes, fluid in your alveoli, as evidenced by your dyspnea, oxygen saturation, ABGs that you send, cyanosis of the extremities, central or peripheral, whichever. Activity intolerance related to imbalance between the oxygen supply and your reduced cardiac output, as evidenced by shortness of breath, fatigue, and ineffective breathing pattern relative to fluid overload, anxiety, or decreased lung expansion, as evidenced by dyspnea, use of accessory muscles. Risk for impaired skin integrity because of edema, and risk for decreased cardiac tissue perfusion because of it can be potential or it can be to the problem itself, and anxiety related to breathlessness, health status, hospitalization, evidenced by restlessness and sometimes not cooperating to your treatment. This is, I have given a detailed NANDA diagnosis with their outcome, nursing intervention. So you can see it, I've given to the major five, that is your decreased cardiac output, your excessive fluid volume, impaired gas exchange, and your activity intolerance. These are your basic four, important four. So you can just go through them whenever you have time as to what you can do. Prevention. Under prevention, we have lifestyle modifications. We suggest to quit smoking, regular exercise, healthy heart diet, and maintain a healthy weight, manage stress, get enough sleep. We tell them to manage underlying conditions like blood pressure, cholesterol, diabetes, CAD, and early detection and intervention, regular checkups, screening, team-based care, medications, AC inhibitors or ARBs, beta blockers, diuretics. This is what we suggest. If needed, digitalis. So this is about prevention. So here we end with what we call a congestive heart failure. And thank you so much for your patient listening. If you have any doubts or questions, please put in the comment box. I'm more than happy to answer them. Thank you so much and stay tuned for more. Bye-bye.